Hello guys, welcome to another video. Today we are going to talk about the gallstones. So gallstones, they are hardened deposit of digestive fluid that can form in the gallbladder. The gallbladder is a small pre-shaped organ on right side on the abdomen, just beneath the liver. The gallbladder holds a digestive fluid called bile that released into the small intestine. Gallstones range in size from as small as a grain of sand to as large as a golf ball. Some people develop just one gallstone, while others develop many gallstones at the same time. People who experience symptoms from their gallstones usually require gallbladder removal. Gallstones that don't cause any signs and symptoms typically don't need to treat it. Gallstones may cause no sign or symptoms. If a gallstone lodges in a duct and causes a blockage, the resulting signs and symptoms may include, for example, sudden and rapidly intensifying pain in the upper right quadrant of the abdomen, or sudden and rapid intensifying pain in the center of the abdomen, just below the breastbone, back pain between the shoulder blades, pain in the right shoulder, nausea, or vomiting. Patient need to directly make an appointment with doctor in case of abdominal pain so intense that the patient can't sit still or find a comfortable position, or the patient has high fever with chills or yellowing of the skin, and whites of the eyes also change to yellow. Simply it's a jaundice. It's not clear what causes the gallstones to form. Doctors think gallstones may result when, for example, the bile that contains too much cholesterol. Normally, the bile contains enough chemicals to dissolve the cholesterol exerted by the liver, but if the liver exerts more cholesterol than the bile can dissolve, the excess cholesterol may form into crystals and eventually into stones. The bile contains too much bilirubin. Bilirubin is a chemical that produced when the body breaks down red blood cells. Certain conditions causes the liver to make too much bilirubin, including liver cirrhosis, biliary tract infection, and certain blood disorders. The excess bilirubin contributes to gallstone formation. We have three types of the gallstone, like cholesterolic gallstones, often appear yellow in color. Those gallstones are composed mainly undissolved cholesterol but may contain other components also. Pigment gallstones, these dark brown or black stones from when the bile contains too much bilirubin. Risk factors including like being a female, being age 40 or older, being Native American, being a Hispanic of Mexican origin, being overweight or obese, being sedentary, being pregnant, eating a high fat diet, eating a high cholesterol diet, eating a lower fiber diet, having family history of the gallstones, having diabetes, losing weight very quickly, having liver disease complications, inflammation of the gallbladder, blockage of the common bile duct, you have blockage of pancreatic duct, and also gallbladder cancer. Inflammation of the gallbladder, a gallstone that becomes lodged in the neck of the gallbladder can cause inflammation of the gallbladder, cholecystitis. Cholecystitis can cause severe pain and fever. Blockage of the common bile duct. Gallstones can block the tubes or ducts through which bile flows from the gallbladder or liver to the small intestine. Severe pain, jaundice, and bile duct infection can be results. Complication also, you have high drops of the gallbladder, small bowel obstruction, gallstone ileus, Bouver's syndrome, you have perforation of the gallbladder, we have choledocholecysteitis, CBD. For diagnosis, best thing is abdominal ultrasound. Exactly focus on the right upper quadrant or the right upper portion of abdominal cavity. We can use MRI, CT scan, but as I said, the best diagnosis method is using the ultrasound. Another type of the gallbladder stone, which is the most common one, is the mixed stones. Over time, cholesterol stones may accumulate in the substantial proportion of the calcium, bilirubin, and other calcium salts, and with the cholesterol together, they are making the mixed stones. For the treatment of the gallstones, we have cholecystectomy, which is gallbladder removal, usually for pigment stones. We are using this. Or residual to dissolve the gallbladder stones, the cholesterol one. Patient must avoid fried foods, red meat, fatty foods, like high diet cholesterol, as I say. Patient should eat more fibers in the diet and those. And always when the patient come to doctor and said, okay, I have gallbladder stones, doctor will not do the surgery directly for him. He will focus and recheck the diagnosis, and when he became sure that he had the gallbladder stone and it's making the complications more and more and making the patient's life uncomfortable, then the doctors are preparing the patient for a surgery and he will remove the gallbladder. Today I talk about this topic because my mother also, she used to have gallbladder removal. She was having the gallbladder stone, which was the pigment one she used to have, and I like to make a small video about it and put it to give some benefit for you and for myself also. Guys, have a nice time. Omar was with you. See you until the next video.